Good afternoon, and thank you. Welcome. Welcome to Paternally Yours. We are a part of the Help Me Grow team, a part of the DC Health family. Our particular session this afternoon is supporting fatherhood inclusion in the early years of development, 0 to 5 years old. My name is Todd Elliott. I am the program coordinator for Help Me Grow and fortunate enough to be a part of the team. Before I get my co-facilitator and our team lead to introduce herself, I'd like to thank her honestly from the bottom of my heart for the opportunity to talk about paternal health in a way that is creative, in a way that's thoughtful. I didn't want to come in just bum rushing the show, but when I got to Help Me Grow, I noticed that on a national level as well as at a local level, we were trying to be inclusive to and about the one. You can't talk about two without the one. And when I say that, that means moms and infants, but also inclusive of dads. And so you're going to hear some of the great works that's coming out of what we have looked at initially, and you're going to learn more about what Paternally Yours is. But thank you so much from the bottom of my heart, Tunde. I love being under your leadership and for your work.
Oh, thank you, Todd, for that warm introduction. I appreciate it. It's great to have an amazing team. So welcome, everyone. My name is Omotunde Sowole-West. Many folks know me as Tunde, and I have the pleasure of serving as the Early Childhood Division Chief, as well as the Program Manager for Help Me Grow at DC Health. And we are located within the Community Health Administration at DC Health, and we're under the Family Health Bureau. So we're super excited to be here to talk about this amazing topic and including fathers. And Todd's really gonna, this is his efforts. As much as he thanked me, I want to thank him for bringing this to the forefront and just really making sure that fathers are included in this space.
So we're going to talk about a couple of the objectives of today's Paternally Yours and Help Me Grow. You're going to learn a little more about what Help Me Grow is. Paternally Yours is the framework of which we actually see our work being important and how we actually frame it here in the district. But it is a national effort with our Help Me Grow national office. We approached them with this particular effort and this opportunity. It was a workshop that was supposed to be done at our national convention in Indianapolis this year, but it did not happen because of COVID-19. But our objectives this afternoon are to discuss the opinions and thoughts of men working to be a part of their children or child's lives. We have had a lot of candid conversation with men in the district. Also, this is conversation that is happening around the country that I've been fortunate enough to be a part of. The second objective is to learn how the Help Me Grow program has become of the prevailing attitudes about fatherhood inclusion. I am very much of the opinion that we've got to change the narrative in terms of fatherhood engagement and change the narrative to fatherhood inclusion. You'll learn more about that and why my feelings are that way, and why a lot of our constituents and a lot of the admin personnel that are involved in fatherhood initiatives also feel this way. And our final objective is to discuss plans to incorporate partnerships, data, strategies that encourage fathers to participate in a more comprehensive and more inclusive, again, maternal and family health network. So what exactly is this thing called Paternally Yours? Well, to be honest with you all, Paternally Yours is an invitation. It's an invitation to fathers in the District of Columbia and potentially around the country and with our affiliates and our Help Me Grow network to encourage them to take ownership of their own health and to also provide support for them in fatherhood programs, fatherhood supports, and outside sort of network support in relationship to fatherhood inclusion. How do we do that? How does this actually take shape? Again, using Help Me Grow as a referral platform and as care coordination coordinators, we'll connect fathers to various services within the district to support their needs and provide guidance on parenting, on support, on developmental delays, and looking at all of the aspects that make a father a good father and a good match maternally and also in relationship to the most important thing, to the child or infant. Now, throughout our particular presentation today, we're going to be asking you to respond in the chat, talk in the chat. I just want to think about this for a minute. With Paternally Yours, this is an opportunity, if you had just a moment to write to your father or to write to your father figure, what would you say? What would you make a list of some of the most important things that actually took place in your upbringing when you had your particular father or your father figure, what would you write? What would you say? Some of the values that you hold true, and then some of the values that you may honestly be letting go of. I will say for myself, my father passed away in February of this year, but I had him for a good while. And I think one of the most important things that I also saw from him and then I learned from him at a distance was character. And it was all about, how are you, Todd, when people aren't watching? How are you perceived when other folks aren't watching? Tunde, can you remember anything, or I'm sure, no pressure, because I know your dad is watching somewhere in California, but can you think of some of the things that you might write or you might remember? And please, think about this to write down in the chat. Tunde?
Sure. Yeah. So I thank you for that question, and I'm looking forward to seeing folks' response for this. So one thing that I just still remember, my dad is a classical music connoisseur. He loves classical music, and that's one thing that I still kind of hold close, near and dear to me now. Even as a mother, that's how I put my boys to sleep. Sometimes playing a little bit of classical music to help them sleep. So that's one thing that I remember. And it helps even soothe me and relax me. And then also my dad is super detail oriented. So I think that's where I get some of my detailedness from, and just kind of being super detailed. So those are the things that really stick out. And also culture. So folks who know me, my father, he's from Nigeria. So really holding those values and just the richness of the background is important to me, and passing that down to my boys and even my husband too. And a lot of times when folks hear my boy's name, they're like, "Oh, you actually named your sons." I'm like, "Actually, no, my husband picked out the names." And although he's not Nigerian, he understood how important that was to me, just because of my relationship with my father.
Absolutely. So we're thinking about father figures, and you'll learn more, and we'll talk more about this. Father figures or fathers, dads, whatever, uncles, grandparents, it's grandfathers. It's very important that we remember some of the aspects that actually shaped us, some of the things that made us. And you'll hear more about that, and we'll go into the chat and talk more about what you guys had to say and what you were thinking about. If we don't get to it throughout the presentation, we certainly have time built in where we can talk about it at the end. I think it's a worthwhile opportunity for all of us to think about just who we are, where we come from, and the duality of that oftentimes gets lost in somewhat of the maternal and infant connection. But our next slide, introduces, Tunde's going to talk a little bit more about Help Me Grow and the Help Me Grow aspects and the detail orientation that sort of comes with care coordination. And I'm going to chime right in with some of the conversations and some of the pinpoints that we've heard from fathers thus far. Tunde?
Yeah, so thank you for that, Todd, and thank you for that that engaging activity, and just the reflection to think back just on some of the things I learned as a child, as a young child. So Help Me Grow as a program, and I really want to touch on how paternal health is really embedded into our system model here, and I'll touch on our components. As you see here, there are 4 components of the Help Me Grow system model. So Help Me Grow is an actual national model. It's not just a local program here. It's a national program that was started in Connecticut in the early 90s by Dr. Paul Dorkin, and he's a pediatrician, and he saw just over the years how a lot of his patients would come in with a variety of issues, a variety of concerns that he was not able to, in that well-child visit, was able to just focus on. So with that, he started this program to really help parents and help families really connect them to different resources that were in the area. So Help Me Grow is literally what Todd said, a care coordination program. We're not here to reinvent the wheel or create another program, but our goal is to connect with programs and resources in the District of Columbia and connect our families to these resources. This is important because just as a parent and as a professional, one of the things that can be frustrating is navigating a system, right? So Help Me Grow really is that care coordination system and really making sure that families, especially in the early years, are connected to those vital services. And the way we do that is our first component, which you see here in the orange, is our centralized access point. We'll touch a little bit about our number. Some of you may have heard 1-800-MOM-BABY, which is a very popular number in the District of Columbia, but that really connects families and providers to the services that our care coordinators are able to provide. Those are also provided in different languages. We have a bilingual care coordinator who works with our Spanish-speaking families, but then we also are able to provide other languages as well through a translation line for our families who need those services. And all they have to do is call, again, you'll hear us say this over and over, 1-800-MOM-BABY, and they're able to be connected to a care coordinator who would then connect them to either child development resources, child social and emotional resources. And one of the things I want to touch on, although that's our main focus, we recognize that families need additional services, basic needs, diapers, safe sleep products. We're in the midst of COVID, so we have a lot of families who've called in around mental health supports. So we want to make sure that we're able to connect our families to those resources so that they're able to be supported. And that all happens through what we call, again, our centralized access point or our CAP. The other two that you see here, which Todd does so well, is outreach. In our green and our purple, we have kind of a two-component outreach approach. We have our family and community outreach, where we really work with our families. We work with the community to really make sure we understand what is needed. Because we may say as a program, hey, this is what's needed for the community. This is what's needed for the families, but we want to hear from families. We want to hear from the community what is needed. So this is why we have different events. One thing that we had last year, an event last year, some folks were able to attend, was our Books and Blocks kickoff event. And we were really excited to do it this year. But as we all say, COVID has come and kind of changed the way we do things, but we will be planning some virtual events to connect with our families in the same way. But with that actual event, we were able to hear what folks needed in the community. And we really take that and we take it back and we work as a team to really make sure that we're able to connect with providers, connect with different organizations across the city. One of my favorite words, and my team knows this, is collaboration. We can't do this alone. We have to work together. I've heard on many of all the wonderful presentations that have been going on, it takes a village. I've heard that as a common theme, and that's something that I hold near and dear to my heart. So really hearing from the community and hearing from families what is needed, but the only way to do that is work as a village. And then there in the purple is our child health provider outreach. And we want to hear from providers as well too. How can we help providers and support providers? Providers are extremely busy and we recognize that and we respect that. So therefore we want to know how we can best at Help Me Grow work with providers in order to support them in their roles in order to help families. And that's what Help Me Grow does. So I'll give you an example. If a pediatrician, is working with a family addresses a concern around their child's development and their child not meeting that particular milestone, all that provider has to do is connect with us. We will work with that family, of course, with that family's consent, and we will make sure that that family is connected to different services across the city. We work closely with our partners at Early Stages, Strong Start, and many other different programs here in the District of Columbia to make sure that our families are connected. And one of the things that makes Help Me Grow really special is that we make sure that we follow up with our families. We're not going to give you a number and say, hey, call this organization. That's it. Goodbye. We want to make sure that our families are connected. And if our families say, hey, we have it from here, we respect that. And we make sure that, we say, if you need us, we're here, 1-800-MOM-BABY when is needed. And then the last component, but a very important component, is our data collection and analysis. And you'll hear me say this a lot, but data is really what drives our program. We come together as a team, as well as an agency, to really look at the data and to make sure that we're doing what is needed for the District of Columbia and their residents. Are we meeting the needs of the residents? So really looking at that data to inform if we're touching the children the way they need to be helped in these early years. So this is how we're able to get to where we are today with paternal health, because as when Todd came on board, he recognized, hey, we really need to support fathers who are calling into the centralized access point, and how can we provide them with services that are needed, especially, dads who may need assistance with supporting moms, supporting family members during early childhood years. So really looking at that data really brought us to where we are today, and brought Todd to come up with Paternally Yours to really work with our national office, but also work with our agency to work with fathers. So Todd is going to touch on some of the things that we heard, not in the community, only in the community, but as well with our families as well.
Thank you, Tunde. Very comprehensive as always. One of the things that I like to say again, the fatherhood inclusion aspect versus engagement, and you'll hear me go back to that on a couple of occasions. That's really important in that particular narrative. But some of the conversations that we heard over and over, and this is just about 5 bullet points that speak to that particular piece, is that conversations on paternal health or men's health need to be enhanced in the early childhood health spaces. We're not having enough conversation about what men need during this particular time period, particularly during childbirth and thereafter. Many fathers have been excluded from their role of parenting for a number of reasons. Some are in what is a mandated role. Some are, feel disconnected from their families. Some are just struggling to put food on the table. And so there were a number of reasons. And I will say this, to Tunde's point, this was what we heard in the district. And prior to, I was in LA at the Father and Families Coalition meeting in January, prior to COVID really taking shape and being recognized as a pandemic. But what we heard out there as well is that many traditional maternal and child health programs don't highlight the role of the father as the social emotional support. As you heard Tunde mention and talking about her dad, the gleam in her eye is that social emotional support, how she feels about herself, the things she remembers as being a child, and that what she can carry over to her own family and her own boys. And I will say this, my wife and I are very aware of when my little 5-year-old thinks I'm a superhero. So she gets all of that, daddy can take care of it, and I can do these things too, from me as the father and as taking the lead. So again, social emotional support. You heard me mention this one earlier. Many of our fathers are dealing with the legal system, particularly in African-American communities and communities of color. We're in a mandated role that has to be supported before we can really get serious about rescuing the child and the family holistically. There's a lot that goes on. Last night, I was so inspired by a couple of young ladies. I have a youth development background, and I just a snippet before I took off for the night. And they were talking about being young mothers and their perceptions of being moms, and with their perception and their perspective in dealing with the fathers of their children, what that actually looks like. And it was very enlightening. It was very heartening, but it was also an opportunity that what we really want to do with Paternally Yours, what Help Me Grow really would like to see, and it's a personal passion, is to help some of those stressful and systemic barriers that are affecting our young fathers and mothers, particularly in the district, particularly in our wards and clusters 7 and 8. We'd like to see those, we'd like to hear from those particular young people. It isn't about just cohabitation. It isn't just about getting married. It's about full role so that all children can have a chance at life, particularly between the ages of 0 to 5, which is so important and so prevalent. So what you'll see in our next slide, if you will, Tunde, what we're discussing in terms of paternal health are what we do in terms of Help Me Grow as a whole. Help Me Grow right now is a national product to the Help Me Grow network and other affiliates. We are a part of and have been charged with a great responsibility as an innovation advisor for a WIC program and WIC Innovations. And Tunde is going to talk more about what we help to provide from the provider perspective, but this is also community related. You have to keep that in mind. Data is not just for data collection's sake. Data says, do we or are we reaching the right aspects of the community? Are we asking the right questions? How can we continually move forward? I love that I'm seeing questions from the chat, and I promise, Kirsten, that we'll get to all of your questions towards the end of our presentation. We promise. But Tunde?
Sure. So thank you for that, Todd. So one of the things, as I stated, is we want to make sure that we're also supporting our providers so that they're able to best support families. And the way, these are just a few ways that Help Me Grow DCs works with providers in order to support families. So we provide consultation and support. What does that look like? So technical assistance. So working with providers to really understand what support they need and different trainings. For example, we do, trainings on the Ages and Stages questionnaire, not just the Ages and Stages questionnaire, development questionnaire, but also the social and emotional questionnaire. So we work with providers to do that training to help them facilitate that. But one of the things that we also do too, I'm skipping down to access to the 1-800 Help Me Grow phone line, but family as well as providers are able to call in to get that screener. And what that Ages and Stages questionnaire is, it just really help families really understand where their child is developmentally as well as social and emotionally. So we work with providers to, if a provider needs to send a family our way to get those particular services, that is one way that we're able to support providers. Again, I can't say it enough, collecting data and sharing that data. One of the things that we do at Help Me Grow is we have what we call a resource directory, and that resource directory is quite rich. And the way we're able to include organization and resources is by exactly what Todd does. He goes out, he does presentations, he works with the community, as I stated earlier, works with providers to make sure that we have the resources that are needed for our families. And we collect that information and we include that information in our resource directory so that when we do partner with different organizations and an organization wants to partner with us, we're able to share that data so that we're able to allow that organization to understand how we're working with their families and to have that shared relationship. Another thing that we do is a quarterly newsletter, and this is something that we put on pause a little bit due to COVID, but we basically, in this newsletter, it's really to highlight the amazing work that is happening in the early childhood health space. There are so many organizations that are working in this space and that are doing great work, and we want to recognize those organizations. And I want to step outside of early childhood for a moment, but there are many organizations that support families just within this space. So making sure we recognize those organizations as well too, because sometimes we have families who call into our call center who have older children. So we want to make sure we understand what resources are out there so that we can internally connect families to those services or externally connect families to those services. And we do that by kind of highlighting those programs within this quarterly newsletter. So these are just a few ways, but we also want to hear from providers. How can we help you so that you're able to really provide that support to families? And one of the things that before I transition back to Todd, there's so much going on in the fatherhood space in the District of Columbia. And Todd has been really instrumental in working with different organizations and different agencies, and even working with our partners internally to really figure out how we can support fathers, what resources are out there for fathers so they can feel supported in this space. And he's going to talk about what that looks like and how he's been able to really garner that support in this space.
Thank you, Tunde. And to be honest with you, this is just a snapshot of the work that's been done, not just done by myself, but we have internal partners. Tunde is all about collaboration. She goes up and down the steps of a 9-floor building or 10-floor building on a regular basis. She encourages us to get involved with our other early childhood partners within DC Health and outside of. but this is what it all look like and where are our sort of starting spaces. These are, again, sort of 5 out of at least 20 different spaces that we'd like to be in, that we already are existing in, and that we're moving forward with connecting to. Our fatherhood care coordination, parent cafes, and there are a great number. I know in Ward 7, there's a lot of great parent cafes that are just dedicated to men and that are dedicated to fathers. But we want to look more into legal rights, mental and physical health. Again, that paternal health supports understanding the cancers that affect men, for example, and looking to work with a number of partners. Tunde has mentioned several. We have so many, and we have a cadre, but we're working heavily with the Fatherhood Commission and members of the Office of Father, Men, and Boys. Thank God for them. Colleges and universities, we're beginning to tap interns that are interested in looking at data sets and looking at sectors of the community. 501c3s, nonprofit. We have researchers, behavioral specialists, other executive office of the mayor affiliates. If you're interested or you're already working with, we know that we had several people sign up for today. Thank you so much for being here. But we want to hear from you. 1-800-MOM-BABY will put you in touch with either one of us, and it will also put you in touch with a little bit of how care coordination works. This other particular piece, and again, you've heard me sort of reiterate this already, to help change the engagement narrative to fatherhood inclusion, fatherhood touches, or navigating fatherhood. Again, you're going to hear in a moment why engagement is one of those things that sort of has created some isolation in my view and view of others in conversation. One of the other things, I come from a background from workforce development in dealing with young people and connecting our fathers and mothers to WIA, WIOA style one-stops trade programs, WIOA, the Opportunity Act, and the Workforce Development Act. What we're trying to do is to give our young people a chance to start certifications, to start trade programs, to look at opportunities, as WIOA says, to look at opportunities to be in a one-stop where they can talk about resume building, they can talk about, but also we want to talk about social, paternal, and supportive supports. Utilizing technology as a means to rally our fathers throughout the district, that's something I can't speak to it wholeheartedly right now. We are working with our Healthy Start partners on a super cool initiative that if it goes into play, our fathers will have a chance to stay connected and are connected from the beginning. And it'll be a nice initiative for DC residents that we can see working with our affiliates throughout the nation. So those are just some of the key sort of points. And moving forward, we've got to make sure that inclusion conversation, okay? Because this is how this came to be. I was at the conference in LA, the Families and Fatherhood Coalition. I've always felt, and I can't take full credit for this, I'm sure someone else thought this way as well. When we said fatherhood engagement, it's sort of a militaristic term. It's sort of war verbiage. We're at war with fathers for them to participate. I think of World War I, I think of World War II, I think of engagement, Pearl Harbor. You know, those are the things that we have to be mindful of, that our language doesn't begin to actually separate us from the beginning. Fatherhood engagement assumes that work needs to happen based on some particular premise. For example, it says that fathers are not already engaged or are not in the picture related to their children. Or in a lot of times, what we learned from those young ladies last night, those fathers want to be a part of, but because of systemic barriers are oftentimes excluded from being a part of their child's life. And it sort of sets them back. So here's the thing in terms of fatherhood inclusion that I've begun to say, and again, if this comes out later, then I want my points for it. But if you never hear it said again, it recognizes that there's active opportunities for real-time changes. It's ways in which we can work surrounding paternal health, and it's ways in which we can include our fathers by saying, hey, why don't you come in and get a blood pressure check with us while your wife is, or while your girlfriend or your baby's mother is being seen by the doctor. Why don't you come in and get a blood pressure check and let's see how your temperature is going and see what's going on with you. So again, inclusive factors that don't necessarily, and I'm not saying that we're getting rid of the entire language, because it's been a long time where we've heard engagement. We see it in every facet, workforce engagement. We see it in youth development engagement. But I think that there's a step that has been missed in when we say engagement versus inclusion, and being inclusive and understanding connectivity through inclusivity. Next slide. So the question remains still, like, Todd, Tunde, you've said all of this great stuff, and this is an opportunity for you all to hop in the chat and to talk about, but why? Why fatherhood inclusion? Why now? What are the values that fathers hold and bring to the table? If you want to take 1 to 2, maybe 3 minutes to put in why now and why this is so important, and we will take a brief pause and we'll get back into some of the reasons statistically why this is so important. So please take a moment in the chat.
And we have some really good questions, Todd, that I can't wait to get to towards the end. So these are really good questions that
I saw that. This is awesome. That means it's happening. So we can talk about a lot of the rationale as to why a lot of information, and we just learned that there's a delay in viewers getting into the chat, and that's no worries. We're all working with this new broadband opportunity. I'm sure there's been some delays in my conversation and delays, but as a whole, the data and statistics that sort of validate our position at this point, it looks like this. 90% of a child's brain development happens before the age of 5. That means that in the womb and up to 5 years old, and I've always said this, maybe up to 6 or 7 years old, those elements of the brain where cognition is taking place, where worry and wonder and all of the wonderful things that how interpretation sort of happens, that's already happening. The last 10% of brain development happens after age 5. So that inclusion of a father figure or two, and you can't talk about two without the one, again, to talking about a father figure is having an opportunity to be a part of an exercise, to introduce an activity to their child in a way that would help brain development. Another thing statistically that we know of to be true is that 1 in 4 children are at risk for developmental delay. And one of the aspects, and Tunde has touched on this, is that those ASQs, doing those particular developmental screenings, but also the interpretation of what those ASQs are all about. That's what really, in those particular screenings, that's what we're interested in. Because a developmental delay, in all honesty, and a lot of people don't talk about this, developmental delays don't have to be life-altering. If caught early enough, they can be used, and we can change some of the assumptions that go along with it. The third particular statistic that influences our thought patterns as it relates to paternal health is that children of mothers suffering from maternal depression are more likely to have cognitive, neurological, and motor delays. Now, even with this example and all the good information here, who's missing? You can't talk about the 2 without the 1. Who's missing in the diagram? And so our data and what we know to be true is that as mom may spiral towards the depressive side, fathers may be more interested in their energy and their efforts go upwards, where they're so excited about wanting to learn what to do, how to hold. I know I was one of those dads that was the first. I couldn't put her down. The nurse told me when and how the baby needed to have some rest and to sleep. So cognition is a big part of it and a big portion of this. And then statistically, again, you've heard me talk about just the facts are this. The facts about social emotional health, that comes 100% from our fathers. But I think what's relative to this particular discussion and this particular summit is that the statistic in the middle, infant death within the first 28 days of life, is actually 4 times higher for those with absent fathers than those with involved fathers. So dad, you're a coach, you're a father now. You're helping mom to understand. I mean, can you think about a scenario where a child is hooked up to a respirator or might be in an incubator? We need you, Dad. We need you around. The National Fatherhood Initiative is awesome with putting out statistics and facts as it relates to children. Again, you've heard me talk about emotional development. And then children who live with their fathers do better in school. So those are just some of the facts. I mean, there's plenty more reasons as to why this Paternally Yours is something that we're targeting, that we're tagging. Tunde, next slide. So just thinking about, again, not just fatherhood inclusion, not just fatherhood engagement, fatherhood inclusion. So again, we're asking, and we can get to it towards the end, so don't worry about the lag or delay. Who needs to be at the table and making sure our fathers are included in early childhood development? Is it health departments? Is it hospitals, behavioral health supports? Is it the legal community? Is it media telling better stories about our communities and communities where fathers are walking children to school, which happens on a regular basis, mind you, in the District of Columbia? You can see it in a regular school day that fathers are happy to walk their children to elementary school and be right there at the end of the days. So again, this is one of those interactive in the chat. Who needs to be here? Is it the faith community? Again, is it the legal community? Is it the Department of Education? And not to call people out, but to have access to actually moving forward in this particular conversation. Thank you, Kirsten, for your sentiments. Yes. Who else needs to be there? It's a long list. It's a concerted effort. And I think just the final answer to that question, Tunde, if you could give us a response to some of the people that need to be involved, what would it look like? It's everyone. This is something we talked about in LA that we are happy to bring back to all of the information. We are certainly proud of the work that Paternally Yours has been able to be a part of, that we've been able to bring around the table. We have a unique opportunity here. The district, with our administration and some of the great works that are being done already. Moving forward, though, our last particular thought around Paternally Yours, and something that you should be thinking about, this is what we need to consider. Dads on the outside, hey, and I've been down this road, trust me, stay down it. I'm fine, I'm good, I'm all smiles. Shout out to the Dads Net. If you ever go and take a look at some of their great artwork and some of the great stuff that they're doing. But dads on the outside, I'm fine. Dad on the inside, I'm lonely, money worries, stressed out, burnt out, feels trapped, confused. Just thinking about having to navigate some of the systems that we discussed and some of the things that we have talked about today. Let's be mindful, not only in our paternal sort of pursuits, but in our everyday pursuits, that we are checking in with our own mental health, that we're being mindful that we are in a pandemic and that things are vastly different than they normally would be. I would say again, it's just what are some of the other feelings or some of the other things that need to be discussed. But in closing, we want to thank you for being a part of Paternally Yours. We hope that you've heard something here today that will spark your interest and that you'll give us a call at 1-800-MOM-BABY. Again, that's 1-800-MOM-BABY, maybe one day, Mom-Dad, 1-800-MOM-BABY. Also on the email, you can email us at helpmegrow.dc@dc.gov. I just want to take, again, a personal thanks to our Help Me Grow national team, our district team who does wonderful work, our care coordinators that are out there beating the street. Special thank you to our DC Health family that is in the streets nonstop, making sure that we're safe and that this particular event can still take place. And also, just on a personal level, a thank you to Mayor Bowser for her leadership and optimism throughout this particular pandemic and also just moving our city forward. Thank you, Mayor Bowser, and thank you to your administrative team. Tunde?
Yes, thank you, Todd, for that very just informative presentation, and just for your efforts on this topic. And just thank you for everyone who's joined us today. Again, if you want to get in touch with us, this is our number, 1-800-MOM-BABY. I do see a few questions in the chat box that we want to touch on. One of the questions that I've seen a couple of different times is, what is the age range of your fathers? Someone's interested in really learning how Help Me Grow with teen fathers. As long as you are a father, we are willing to work with you. We definitely can do presentations with high schools as well, because we recognize this, even from hearing Todd touched a little bit on this earlier, from the amazing young women who spoke last night, the last session last night, and just their experiences of navigating the system. We really want to work with those young parents, and to really, because even just now as a mother, it's hard to navigate a system. So just being young, I can only imagine just how hard it is to navigate a system. And that is what Help Me Grow is here for. So another question, there's so many great questions. What do you think we can do as a society in order for fathers to be considered in a child's life? I'll let Todd answer that one. And then I also do want to recognize there were a bunch of questions on just kind of the legal system and just how to work better with fathers to really support them. So I don't want to, the next session after us, they're really going to touch, and their colleagues and partners of ours, they're going to touch on just working with fathers who have been incarcerated and coming out of the incarceration system. So I think they're going to do great in really touching on that and this amazing work that they have done. So I'll start it off. So one of the things I think is important to really support a family as a whole. I think that's number one. And that is what we at Help Me Grow, we want to provide as many resources to families to support them. And that is where we're always looking for ways to fill the gaps that may be there. So we want just some of the things that we've already recognized as a team is just seeing the many great presentations that have gone on within this summit. I've already reached out to my teammates and say, hey, we need to connect with this organization. They're doing great work in this field, because something that I always say when I sit at the table is, we all work with the same families. We all work with the same providers. And how can we work better collectively to meet a common goal? We all want our children to grow up healthy. We all want our children to strive. And the only way to do that is to work together and to make sure that we're sharing resources. And I can't say that enough. So there's, go ahead.
I'll also, just to echo 100% of that, but the other aspect that I think we've got to meet our families, and you hear this so often, but we don't practice it enough. We've got to meet our families where they are. We have to meet our young fathers as well as our older fathers, as well as, expectant fathers that have had experience, the whole nine. As men, we have to have more men in these conversations and talk about mistakes and talk about challenges and talk about the things that upset us. And we can't, once we have a child, then it really is sincerely, the maturity level has to be placed on that particular child. And what I mean by that is we have to have a standard by which we interact and that we talk with our particular partner, no matter if, it's all about when the love, quote unquote, and the lust is gone, who's left and who's still standing? It's the child. And so putting a lot of focus within that, regardless of the particular circumstances you find yourself in with the child's parent or your significant other.
And I'll get one last one last question before we end. Why do you think fathers are left out of the family unit?
Well, besides the elemental theories that I could get into and redlining and all of those sort of elements, I think that out of convenience it's become something that we've become used to, and it's not until we have opportunities like this to talk about maternal health and talk about the importance of why are men more likely to have diabetes, why are we having more instances of pancreatic cancer, different elements, because if we start talking about health and start talking about living longer, then there's the opportunity for us to be, there's my word, inclusive. So I think inclusivity, I think engagement, taken back from some of the conversations that I've had around the country and also locally, is that it's just been easy. And it's become not only coincidental, but it's become a part of the systemic barriers that we are actually a part of the actual barrier itself. And so again, wow, that's a huge question we could spend days and nights on. I don't know, Tunde, do we have time for more?
We don't have time for more questions, but again, I do want to say if folks, we have a number of amazing questions, but if folks want to reach out to us again, we can come to you to do presentations as well as work with your organization, work with your families. We are here, but we want to make sure that you all know we're here as a resource. So again, 1-800-MOM-BABY is the way to get in contact with us. Our wonderful care coordinators will make sure to send us that information. So if there's a presentation you would like us to come do with your families, with your providers, please let us know. If you have families who can benefit from these services for young children 0 to 5 years of age, please contact us. We have a referral system that our care coordinators can work with you all to make sure that our young people grow up to be healthy. Again, 1-800-MOM-BABY. I can't say enough. It's an easy number, so that's why we keep throwing it out there. But please reach out to us. And again, thank you for having us here. And this is amazing summit and just hearing all the amazing presentations that have gone before us and that will go after us. Thank you.